12 early warning signs of heart disease your body is telling you about. Are you aware that approximately 800,000 people undergo a heart attack in the United States of America every year? The negative aspects of contemporary life are increasing the likelihood of having a weak heart, which frequently poses a threat to one's life. In spite of this, you may safeguard both your own health and the happiness of your family by being aware of the early warning signs of heart disease, such as stroke, heart failure, etc. Today, we'll explore 12 such warning signs. Understanding these signs may be a crucial step in your journey to better health. Always consult your healthcare provider if you suspect that you have a deficiency. Also, you must consult a dietitian before making any changes to your diet. Without any further delay, let's get started. 1. Chest discomfort, angina. One of the most telltale signs of possible heart problems is chest discomfort, also called angina. A decrease in blood flow to the heart muscle as a result of constricted or blocked coronary arteries is the usual cause of this condition. When the heart is not getting enough oxygen-rich blood, it may lead to chest pain, pressure, or even a burning feeling. Increasing your intake of foods rich in omega-3 fatty acids may help. A number of studies that have been conducted over the course of 10 years have investigated the connection between omega-3 fatty acids and healthy heart function. There were approximately 46,000 participants in the age group of 18 to 97. This demonstrates that the components of ALA, DHA, EPA, and DPA were all associated with a reduced risk of cardiovascular disease, which may be fatal. 2. Breathing problems. It is a very common instinct that whenever we feel shortness of breath, we suspect a heart problem. A common complication of congestive heart failure is pulmonary edema, an accumulation of fluid in the lungs that may obstruct the exchange of gases such as carbon dioxide and oxygen, making it difficult to breathe. In addition, heart disease may reduce the cardiac muscle strength and efficiency in pumping blood. As a result, the body does not receive sufficient oxygen-rich blood to meet the demands, particularly during physical activity, which results in a restricted ability to breathe. In order to improve the condition, you should consume foods that are high in potassium. It plays a role in the regulation of blood pressure and may effectively reduce water retention, which may put strain on the heart. A daily consumption of 3,500 milligrams of potassium was associated with a 13% lower risk of stroke, according to the findings of a total of 16 different cohort studies from different countries. 3. Fatigue and tiredness. Have you been experiencing persistent fatigue, even after getting a sufficient amount of sleep? It is not always connected to a diet that is undernourished. It is also possible that this is an early indication of a weak heart. Specifically, coronary artery disease may reduce blood flow to the heart muscle by narrowing or blocking the coronary arteries. Hence, the heart becomes impaired in managing the proper blood flow. As a result, the cells don't receive enough oxygen to burn glucose for energy, leading to persistent fatigue. One of the most common heart problems is stroke, which often follows fatigue. A study of heart patients aged 58 to 70 found that stroke survivors had high fatigue and poor sleep quality. Even after a number of years had passed since their stroke, 52% of the people who took part in that study reported feeling exhausted, and 64% stated that they had trouble sleeping. 4. Palpitations, or an irregular heartbeat. Another concerning sign of heart disease is palpitations, or the sensation of irregular heartbeats, arrhythmias, which happen when the electrical signals telling the heart to beat incorrectly are a common cause of this symptom. A racing, fluttering, or pounding heartbeat could be the result of a cardiac arrhythmia, problems with the heart's electrical pathways, damaged heart tissue, or irregular signal sequences are all possible causes of this condition. To counter this symptom, experts advise eating more magnesium-rich foods like spinach, almonds, and avocados. The results of a study showed that irregular heart rhythms could be improved in patients who had previously had cardiac surgery by administering a bolus dose of 60 millimoles of magnesium. 5. Dizziness. If a person has a heart condition, there is a significant possibility that they will experience episodes of dizziness or even fainting. When the heart is unable to pump blood effectively, it may lead to a disruption in the delivery of oxygen to the brain. This could be the result of a slow or fast heartbeat, and it could also be an indication that the electrical system of your heart is not firing in the correct order. Whenever you feel dizzy, it is highly important to look after your liquid intake. Drink enough water and maintain a healthy balance of electrolytes in the body. On top of that, foods that are high in potassium, like oranges and bananas, might be able to help support the body's electrical function. 6. Swelling in the legs, ankles, and feet. Many heart patients often experience swelling in the lower extremities. The accumulation of fluid in the legs, ankles, and feet may occur when the heart is having difficulty pumping blood effectively or efficiently. In addition to this, patients who have heart conditions may experience an increase in the blood pressure that is present in their veins, particularly in their lower extremities. As a consequence of this elevated pressure, fluid may be forced out of the blood vessels and move into the tissues that surround them. It may lead to swelling in the legs. Those who consume a high amount of sodium in their diet have a 19% higher risk of developing cardiovascular disease when compared to those who have a low sodium intake, according to the findings of an analysis that was conducted on 36 different research reports. There is also evidence that a 1 gram increase in sodium intake is associated with a corresponding 6% increase in the risk of cardiovascular disease. 7. Nausea. It is easy to think that stomach problems are the sole reason for nausea, but these symptoms could be a less obvious sign of heart disease. When blood flow to the stomach and intestines is limited, it may mess up the digestive process, which may make you feel sick. Traditional ginger medicine for nausea may help ease some of these symptoms. Several studies have found that ginger may also help lower cholesterol and improve lipid metabolism. Both of these may lower the risk of heart disease. 8. Repetitive sweating. A sweat crisis may be an early sign of adaptation, or more accurately, cardiac maladaptation in the early stages of heart failure. Patients who are suffering from acute coronary syndrome or cardiac arrhythmia may also experience a sweat crisis. It is a sign that the heart is pumping too much blood through the body. When the heart is not functioning properly, the body may perceive a threat to its own survival. The response of this system is to cause an increase in sweating as a means of bringing the body's temperature down. In contrast to the normal perspiration that occurs during exercise or when the body is exposed to high temperatures, this perspiration may be extremely heavy and icy in extreme cases, such as a heart attack. 9. High blood pressure. Hypertension. Damage to the inner lining of the arteries may happen if someone has high blood pressure. This makes the arteries more likely to build up plaque, which is a piece of fat. It may lead to atherosclerosis, a disease in which the arteries get narrow and stiff. This condition may make it so that less blood gets to the heart muscle, which increases the chance of getting coronary artery disease. A study found that having blood pressure equal to or higher than 115/75 millimeters of mercury makes you 49% more likely to have coronary heart disease and 62% more likely to have a stroke. In order for the heart to pump blood against the increased blood pressure, it must exert more effort. This may lead to a condition called left ventricular hypertrophy, in which the heart muscles get bigger. In the long run, this condition could make your heart muscle weaker, which would be bad for your health. 10. Obstructive sleep apnea. There is a strong correlation between obstructive sleep apnea, a condition in which the muscles of the throat relax and block the airway intermittently while sleeping, and hypertension, which is a major risk factor for cardiovascular disease. The causes of this are repeated oxygen deprivation and stress brought on by apnea episodes. Sleep apnea may activate the sympathetic nervous system, which controls the body's fight or flight response. Chronic activation may lead to an increased heart rate and blood pressure, contributing to heart disease. The intermittent hypoxia, or lack of oxygen, experienced during sleep apnea may lead to endothelial dysfunction, which is a precursor to atherosclerosis, a condition where the arteries become clogged and may lead to heart disease. 11. Pain in the arms or shoulders. According to the findings of a study that involved about 1,200 workers, individuals who had a greater number of risk factors for heart disease were almost 5 times more likely to experience shoulder joint pain or rotator cuff issues than those who did not have such risk factors. Shoulder pain, which may include joint pain and injuries to the rotator cuff, has been linked to heart disease. It often occurs due to insufficient blood flow to the arms and shoulders. The correlation between heart disease and other musculoskeletal conditions, such as carpal tunnel syndrome, tennis elbow, and Achilles tendonitis, is consistent with the findings of this association analysis. 12. Blue or purple skin. It is possible for cyanosis to develop in the body when there is an insufficient amount of oxygen in the blood. A blue appearance of the hands, fingers, toes, and feet is a sign of this condition. The majority of the time, it is an indication of underlying heart conditions such as peripheral arterial disease or congestive heart failure. This condition is characterized by a white or blue discoloration of the skin, which most commonly occurs in response to cold temperatures or stress brought on by decreased blood flow. Certain blood disorders, such as methemoglobinemia, are characterized by the inability of the hemoglobin to effectively release oxygen to the tissues of the body. It may result in a skin coloration that is either blue or purple. What are the most dangerous heart diseases? You are now aware of the early warning signs of heart disease. Therefore, it is time for you to become familiar with the different types of health problems that may occur. Keep watching to learn about some of the most dangerous cardiovascular conditions that may kill you or cause serious complications. 1. Coronary artery disease. Ischemic heart disease is the most prevalent form of the disease. This condition manifests itself when the arteries that supply blood to the heart muscle become calcified and constricted as a result of the accumulation of plaque, which is composed of cholesterol and other kinds of materials. In addition to chest pain, coronary artery disease may also result in heart attacks and heart failure. 2. Myocardial infarction, heart attack. A heart attack happens when a part of the heart muscle doesn't receive enough blood. This may cause permanent damage to the heart muscle and is often due to a blockage in the coronary arteries. 3. Heart failure. It is a persistent condition in which the heart does not pump blood as effectively as it should during times of stress. A number of different types of heart disease, such as coronary artery disease and hypertension, may lead to heart failure. This is a serious condition that needs to be managed throughout one's entire life. 4. Arrhythmias. These are conditions that affect the rate or rhythm of the heart, such as atrial fibrillation, which may result in adverse outcomes such as stroke, heart failure, and sudden cardiac death. 5. Valvular heart disease. It is possible that one of the 4 heart valves has been damaged or is defective in this case. The severity of the condition and the valve that is affected both play a role in determining the potential for major complications such as stroke, heart failure, and sudden cardiac death. 6. Aortic aneurysm and dissection. These conditions have an impact on the aorta, which is the main artery that leaves the heart. An aneurysm is a bulge in the aorta that has the potential to rupture, which would result in critical bleeding. It is also possible for a dissection to be life-threatening because it causes a tear in the wall of the aorta. 7. Congenital heart defects. This refers to abnormalities of the heart that are present at birth. Some of them may be relatively minor, but others, if left untreated, may become extremely serious and even life-threatening. What are the most well-known heart-healthy foods? There are a number of foods that are advantageous for the health of the heart because of the nutrients they contain and their capacity to support cardiovascular function. We have included a few of them here for your reference. Fatty fish such as salmon, mackerel, and sardines, which are high in omega-3 fatty acids, are known to reduce inflammation and decrease the risk of heart disease. Moreover, foods like oats, brown rice, and whole wheat contain high fiber, which may help lower cholesterol and improve heart health. Apart from that, nuts and seeds are rich in healthy fats, fiber, and vitamins, which are beneficial for heart health. Strawberries, blueberries, and raspberries are rich in antioxidants and phytonutrients that may help reduce the risk of heart disease. You should also include leafy greens and fruits like avocados for better heart health. Last but not least, dark chocolate is high in flavonoids, which have been linked to a reduced risk of heart disease. It's important to choose varieties that contain at least 70% cocoa and consume them in moderation. Incorporating these foods into a balanced diet, along with regular exercise and other healthy lifestyle choices, may significantly benefit heart health. It would be irresponsible to disregard these 12 early warning signs. If you or someone you know experiences any of these symptoms, seek medical help immediately. Maintaining a healthy lifestyle involves regular exercise, a balanced diet, and stress management. Regular visits to your primary care physician may also monitor your heart health and detect issues before they become serious. By being vigilant and making informed decisions, you may greatly reduce your risk of cardiovascular disease and live longer. We have discussed the many warning signs related to heart disease, but as we know, our daily diets play a crucial role in maintaining our overall health. If you are looking for more food-related videos, here are a few more we recommend you check out. Watch 12 foods that are destroying your heart and clogging arteries. Or try 10 superfoods that may help protect your kidneys from damage. Go ahead, watch one, or even better, both. Do you suffer from any of the specific heart disease signs mentioned here? Tell us in the comments section below.